and we will start this Learning Lab session now. Hello, everyone. My name is Hallie Perlich, and I will be the technical manager for this session on economic evaluation, chaired by Carol Levin. Thank you for taking part in this ANH Academy Week. We're so glad that you could join us, and we hope that you've been enjoying the event thus far. A quick reminder that everything you might need to access about the conference is available on our website at anh-academy.org/ANH2020. Before Carol takes the conversation forward, I have a few small technical announcements. First, this session is being recorded and it will be posted on the ANH Academy website following the conference. Secondly, all participants have been muted, but please feel free to introduce yourselves using the chat function, which you can find at the bottom of your screen in your Zoom window. Please let us know your name, where you're joining us from, and the organization you work with. Later in this session, we'll be opening up the conversation for a Q&A. If you have questions, we invite you to share them in the chat box throughout the session, and we'll do our best to get through as many as possible during the Q&A. Last, if at any point you experience any technical difficulties, please check your audio and internet settings. You can always try to reconnect to the session using the same link that you used to get here today. If you have a technical question, please feel free to send me a private message using the chat box. Thanks so much, and Carol, over to you.
Great. Thank you, Hallie, and all of the organizers from ANH Academy making this available as an online platform. We really appreciate it. Good morning, good afternoon, good evening from wherever you are joining. Welcome to the Learning Lab on strengthening economic evaluation for multisectoral actions in health and nutrition. Let me introduce ourselves before we get going. My name is Carol Levin. I'm an agricultural and health economist. I have over 25 years of experience working as a research fellow at IFPRI many years ago, followed by being a health economist at PATH, an international nonprofit in global health. And now I'm a clinical associate professor in the Department of Global Health at the University of Washington. Currently, I'm the project director of the SEAMS Nutrition Project, which you'll hear about today. Today, I'm joined by Dr. Christopher Kemp. Chris is an implementation science and junior faculty member at the University of Washington in the Department of Global Health. His work focuses on integrated and multisectoral approaches to improving outcomes related to nutrition, mental health, and HIV/AIDS. He will be presenting tools that we've developed as part of the common approach to measure costs and benefits of the SEAMS Nutrition Project. I'm also joined by Dr. Chloe Puett from Stony Brook University, and Chloe is also a consultant on the SEAMS Nutrition Project. She's a researcher with expertise in assessing cost and cost effectiveness of nutrition and food security interventions in developing countries. Chloe will provide field examples discussing challenges from her experience in conducting cost effectiveness analysis for nutrition sensitive investments and talking about potential solutions. We hope by the end of today's Learning Lab, you will know the basic steps in conducting an economic evaluation, that you'll be familiar with the SEAMS Nutrition Framework and a set of tools to support cost data collection analysis, and that you'll understand some of the challenges of applying economic evaluation to multisectoral nutrition programs and how to address these. Thank you to so many of you for filling out the survey. We were able to, we think that we're going to meet most of your expectations for today's sessions. We will be available to answer questions after today's session, and we'll be sharing with you a lot of resources to help you continue your learning offline. So today's Learning Lab is in 4 parts. The first part will be really a broad overview to understand the types of, excuse me, economic evaluations for measuring costs and benefits for multisectoral nutrition sensitive programs. The second session will be presenting the SEAMS Nutrition Framework. I will be leading sessions 1 and 2. Then Chris will be leading section 3, and he'll apply the SEAMS nutrition tools to a synthetic multisectoral case study. Section 4, Chloe will present the benefits and challenges of economic evaluations for multisectoral nutrition interventions. And then at the end, we will answer your questions. So remember, please ask them in the chat box as you're going. We'll try to cluster them and do our best job to answer your questions. We will be having a couple of quiz and polls throughout the session, so get familiar with the chat box, and we're going to launch our first pre-Learning Lab quiz. Now, these questions before the Learning Lab are broad. I'm warning you that we're going to have 3 specific questions at the end of the Learning Lab, and we hope that by the end of the Learning Lab, you'll be able to answer these questions. So let's get going with our first Zoom quiz. The question is, and it's a true-false or false-true, economic evaluation include a range of comparative methods to help evaluate choices or trade-offs between costs and benefits. True or false? Please just answer the first question for now. In fact, all the questions, so I'll go through all of them and you can answer them all 3 at one time. The total economic cost of an intervention includes the opportunity cost of all resources used, whether or not they were paid for. True or false? And finally, the last question, it's easy to value the multiple benefits from improved agriculture, food security, health, nutrition, and gender empowerment resulting from effective multisectoral nutrition strategies. So we'll wait till we get a good over the majority of you voting. So it looks like for the first question, and please keep your answers coming, we've got about 70% of completed voting. So with 75% of you getting your vote in, all right, 80%, let me go ahead and start to answer the first question. It looks like most of you are familiar with economic evaluations. You understand that these use comparative methods and they evaluate choices and trade-offs between costs and benefits. So we start with a shared understanding. For the second one, 83% of you understand that economic costs include opportunity costs. And for the final one, we've got a little bit more diversity on whether or not we think it's easy to value the multiple benefits from improved multisectoral nutrition strategies. So in an effort to save time, I'm going to close the poll now. Thank you for your vote. And we're going to move on to the next, sorry, and here, here are the results. I'm not sure if you're seeing them or not. And we'll move on to the next to carry on. So let's just take a step back, set the stage for why we do economic evaluations before we get into it. We recognize in the field of global health for sure that when spending is guided by evidence, millions of lives can be saved. And this is also true in the area of economic development, agriculture, and environment, right? We can improve livelihoods when we spend our money wisely. There are about 4 main uses for using economic evidence, and these are up on the slide right now. So economic analysis will help us set priorities for resource allocations. We're typically working in an area where resources are scarce, and economic analysis helps us to consider those choices. So many in the area of introducing new interventions or new technologies, whether they're health technologies or agricultural technologies, there are a lot of important decisions that hinge on whether or not the investment is good value for money. We often are trying to identify what is the best set of interventions for a package of multisectoral approaches. What are the coverage decisions? What should we invest in scaling up? What should be in or out? How should we price certain interventions? And for new technologies, we need some sort of go, no-go decision. So economic evaluation helps us to set those kinds of priorities. as I mentioned, there'll never be enough resources to fund all of the things we know are important to reach the SDGs. And so how do we understand what the resource needs are and what those gaps are? So economic evaluation is useful for understanding the resource requirements, and these are often used for advocating for investing in interventions that would reduce poor nutrition or reduce disability and death associated with poor health. Economic evaluations help to inform advocacy. They help to inform project planning and management so that we use the information on whether it's good value for money, but we also have to understand, is the investment affordable given donor or government budgets? So we have to understand both value for money as well as affordability. And then we really care about whether or not we're improving technical efficiency. If we have limited resources, we want to make sure that we're spending those resources to maximize the output for a given set of investments or inputs, and that would be improving technical efficiency. So economic evaluation helps us to do this in almost every sector: health, agriculture, environment. Economics have developed methods to ensure, to measure the value of policies, interventions, and technologies. So what is economic evaluation? It seems that most of you already know that economic evaluations include a range of comparative methods to help evaluate choices or trade-offs between costs and benefits. Now, most of you all seem to also know that at the heart of economic evaluation is this concept of the opportunity cost. Opportunity cost is a governing concept. Any resource that's used to achieve one program goal or objective is not available for use elsewhere. So to foster efficient use of limited resources, economists are concerned with measuring opportunity costs to help inform choices. We want to understand what is the best value for money. So on this slide, in the most basic sense, cost is what you pay, value is what you get, or benefits. Now the truth is, it won't always, a cost-benefit analysis, cost-effectiveness analysis, cost-utility analysis, which we're going to learn about in a moment, will not always indicate a clear choice, but at least we are evaluating our options quantitatively and based around a clear decision problem. And it is a method that is really great at capturing the opportunity cost of doing one thing over another. So for example, we can compare the costs and benefits in home visits compared to perhaps a mass media campaign to disseminate behavior change communication to improve infant and young child feeding, right? Or we can use economic analysis to compare biofortification with home gardens or with vitamin A capsule supplementation to address micronutrient deficiencies. So we can compare which of those gives us best value for money and which is affordable. And remember, economic evaluations are about comparisons. We not only do we compare costs and benefits, but a comprehensive evaluation will also compare options and scenarios. So let's go ahead now and look at those specific types of economic evaluations. There's a large family of economic evaluation methods. I hope many of you got a chance to read the ANH Academy technical brief, and maybe you remember the tree or the family of economic evaluations. We're going to focus on 4 of these today. The most basic type of economic evaluation is a cost efficiency analysis. So as you can see, all economic evaluations measure costs, but they differ in how they measure effect. Cost efficiency analysis actually only looks at the output achieved by an intervention. This is a partial form of economic evaluation because it's not really looking at effectiveness or impact. It's really measuring reach. So typically we'll report out on the cost per output achieved. Now, a number of approaches are available to understand economic costs and impacts of health outcomes. The most common type of economic evaluation for health interventions is cost effectiveness analysis. Cost effectiveness analysis compares the cost and outcomes of two or more alternatives, or it compares a new intervention to the status quo. Cost effectiveness analysis relates the cost associated with a health outcome, such as a cost per disease averted, cost per stunting case averted, or cost per death averted. It may look at the cost per additional life year gained. Now, the cost effectiveness analysis can only look at a single unit. Cost utility analysis is a method that allows you to compare costs with multiple health outcomes. The most common approach used in low and middle income countries are using what's called disability adjusted life years, or DALYs. This is a health index that represents the years of life lost due to death or illness because of a condition such as undernutrition or malnutrition or overnutrition. The indicator combines the year of life lost due to early death with the years lived with disability. Poor health and conditions that result in premature death and disability result in a large burden of DALYs, right? So DALYs are a bad thing, and we want to minimize those. DALYs measure that gap between ideal health states and the actual health of the population, right? So we typically want to minimize DALYs. The last method I'm going to speak about is cost-benefit analysis. This is actually a method in which both the costs and the effects are measured in dollar terms. In agriculture, cost-benefit analysis is used frequently, and so the value of the effect or the benefit might be an increase in yields and acreage that can be monetized. We can also think about using cost-benefit in large infrastructure projects, the benefits of investing in a hydroelectric dam. Now, while cost-benefit analysis is a popular method in these kind of agriculture and infrastructure, it's been less well accepted and less used in the area of health and nutrition, because placing a dollar value on health benefits is difficult to do empirically and even conceptually. So, however, recent guidelines from Harvard University are helping to advance the application of cost-benefit analysis for the use in health and other multisectoral investments to improve nutrition. So let's look at some characteristics of economic evaluations, just some of the basics. There are many different sources of cost, and basically, cost is a method for valuing our resource use. There are inputs from really three main buckets: capital, labor, and supplies, right? And so you can think of equipment under capital. For labor, you can think of Ministry of Health or Ministry of Agriculture staff or international or local NGOs or volunteers, or even the labor that our beneficiaries or participants might provide. Supplies and inputs are things like agricultural seeds and supplies. So once you value these inputs or resources, basically you get your cost. Now, there are a lot of different sources of costs, and that's what starts to get complicated. We have costs from donors, from governments, from providers, from international and local NGOs, as I mentioned, from the participants themselves. And there are a lot of different ways to describe cost. We can think about real-world costs or costs associated with a randomized controlled trial, or even by timing of costs and whether they're fixed or variable. So what we want to help highlight today is an important distinction in cost, especially for economic evaluation, and that is the concept of economic cost and financial costs. Both are used for understanding the cost of multisectoral programs. Economic costs include inputs that aren't paid for necessarily out of a program or project budget. They may reflect donated goods or volunteer labor. They're always used for economic evaluations, like cost effectiveness analysis or cost utility analysis. Financial costs represent the actual amount that was paid on goods and services. These are used for affordability, for budget allocation, and they are often combined with economic costs in economic evaluations. So how about for a moment, you take a minute and think about what are some of the donated goods in a multisectoral nutrition project that you work on? Please list your responses in the chat box. And I'll check in with Chris to see what some of your responses are. Chris, do we have a few responses you can share with us?
Just had one so far. Donated equipment for seed production, equipment supplies, micronutrient supplements, the land, and community labor.
Awesome. Those are great examples of goods that are donated both by donors in some cases and then by the community and the households themselves. Thank you. Now think about what are some of the examples of typical financial expenditures in a multisectoral project that you've worked on? List your responses in the chat box. Chris, have we got any responses coming in?
We've got a couple responses related to inputs for agriculture, seeds and fertilizer, technical assistance in the field, import taxes, and of course the cost of employees, drugs, and transportation.
Excellent. So these are typical costs that are covered directly out of government or intervention programs or project expenses. Thank you. So let's move on to the second important characteristic of an economic evaluation, which is a measure of effectiveness. These measures of effectiveness should be clear. Now, these typically include changes in benefits measured as agriculture, poultry, or aquaculture outcomes, nutritional status outcomes, or other health outcomes. In the field of agriculture, as I mentioned, these may be increased yields and the value of increased production, or this may be the value of increased poultry or fish production. In global health, we typically look at, as I mentioned earlier, nutrition cases averted or an illness averted, or we look at DALYs. Now, in nutrition-specific interventions, we might look at micronutrient deficiencies averted, like vitamin A deficiency or anemia case averted. There are other outcomes that may be important in the long run, like the years of schooling completed because of our interventions, or improved wages and agricultural productivity. And we'll talk about how these are included in our examples. So typically, here's an example of what's included in a cost-effectiveness analysis. Typically speaking, a cost-effectiveness analysis will include several different kinds of costs and outcome data, as I've been alluding to. For example, depending on the objective of the analysis, you're likely to include cost of service provider, the NGO, or the government ministry. One might also choose to include the household or participant costs. These costs would include participant transportation, or any kinds of fees paid in participating in clinical services or community-based activities, or any wage loss they may experience while participating in program-related activities. When you add all these costs together, you'll get a total cost of your program. This becomes the numerator in a cost-effectiveness ratio. You divide these costs by the various outcomes of your program. You may have a number of children recovered, for instance, the number of all beneficiaries. You may calculate a disability-adjusted life year. You may look at the number of children treated. Cost effectiveness is typically expressed as a ratio, as I mentioned, and where you divide the cost by that health or nutrition outcome of interest. So then you can divide the cost by each outcome of interest. This gives you a cost effectiveness ratio, and it's this number, that cost per outcome achieved, that allows you to judge the resource use in this program. Now, remember, I mentioned that cost-effective economic evaluation is typically comparative. So we really do care about a comparative analysis. And when we look at two interventions, intervention A and intervention B, let's say biofortification compared to perhaps vitamin A capsule supplementation, so A and B, what we're really looking at is a comparison of the cost to A with the cost to B. And we compare those to the DALYs averted in A and B. And so we call this an incremental cost effectiveness ratio. This is the ratio of the difference in cost between two alternatives to the difference in effectiveness, in this case DALYs, between those same two alternatives. This is a basic incremental cost effectiveness ratio. And just quickly to go over the reporting results, Cost efficiency is a cost per output achieved. The intervention is $55 per household reach. That's a typical cost per output metric. Cost effectiveness analysis is a cost per outcome. This looks something like the intervention cost $200 per child recovered from acute malnutrition. And cost benefit analysis generates a ratio of benefits to cost. And if that ratio is greater than 0, then it generally is a good investment. So what do we do with that information? How do policymakers use the results from economic evaluations? Remember, policymakers need evidence. They typically should not just be investing based on divine intervention, right? But they do look at cost effectiveness along with feasibility, acceptability, maybe the burden of disease that they're trying to address. But hopefully when you're working with decision makers, they have a clear effectiveness target so that they're interested in minimizing the expenditures needed to achieve that target, like meeting perhaps the World Health Assembly nutrition goals. And they should also have a clear budget constraint so that they can maximize those health and economic benefits within the budget. And ideally, they have some acceptable threshold that's clear and explicitly stated. But I can tell you that these aren't always clear in reality. So what do we do in the area of global health? Well, we've been traditionally using a threshold based on a country's GDP per capita, their gross domestic product. And we've traditionally said that if a intervention is cost effectiveness ratio is less than the GDP per capita, it's very cost effective. And if it's 3 times the GDP, it's cost effective. Now, recently, there have been a number of researchers who are challenging the usefulness of this threshold because so many interventions actually meet this criteria that it isn't really useful for priority setting. And so there are some recommendations to make these thresholds more locally relevant, and we've provided some references for you at the end of this presentation. And now quickly, because I'm running out of time here, I'd like to just indicate that we traditionally conduct economic evaluation, particularly cost effectiveness analysis, at the end of the project cycle. Why? Because we need to have measures of impact that feed into the analysis. Now, we can look at cost efficiency indicators along the way, but for cost effectiveness, the full economic evaluation, this typically will occur at the end of a project. There are some cases where you might like to conduct economic evaluation before scaling up an intervention, and that would happen after perhaps randomized controlled trial or a pilot, where you might like to look at the benefit cost analysis or cost effectiveness of scaling up at a national level. There are 4 broad steps in conducting a cost effectiveness analysis or cost utility analysis or even cost benefit analysis. And we will be going over these in greater detail and how we've used these in the Seams Nutrition approach. But basically, you have to frame the evaluation. What is your decision question? You have to identify, quantify, and value resources needed. You have to quantify and value health and economic consequences. And you have to present and interpret the intervention for decision making. Basically, we are all applied economists if you think about it. We evaluate costs and effects every day when we make purchasing decisions, how we spend our own budgets. We are next going to explore how we can apply these conceptual and theoretical concepts in economic evaluation to a specific multisectoral approach for nutrition. Chris, are there any immediate questions that we might answer before we go on to section 2?
Nothing yet.
Great. So I realize that's a lot of information. Here are resources for learning more. There are general guidance documents for public health, nutrition, and early childhood development. There are additional readings on thresholds. And we are sharing with you critical guidance documents on principles for economic evaluation, costing, and benefit cost analysis. So if there are no questions, I'm going to switch to our second session. Any questions that we can answer easily? Great. Okay, so let's go ahead and now jump into what maybe many of you are interested in hearing about, which is a new framework for applying economic evaluation to multisectoral actions for health and nutrition. And I don't think I have to tell this group, many of you who are working in integrated agriculture, health, and nutrition sectors, why this information is so important. But evidence on costs and benefits is essential for achieving our World Health Assembly targets and for achieving the SDGs. Other sectors, especially global health, rely on economic evidence to make their case, and we need to catch up and generate robust data for that. So decision-making around implementation of multisectoral nutrition programs should be supported by information on what's cost-effective and cost-efficient to promote food systems globally, right? And so we need to generate these evidence so that we can be informing global and national investment decisions. Now, unfortunately, there's little evidence currently on cost and benefits for multisectoral nutrition strategies. We have a growing body of evidence for nutrition-specific interventions as recommended by the Lancet series, but there's really limited information on multisectoral and integrated approaches. And what's available, critical interventions are missing. For example, evidence on cost and cost effectiveness of marketing and certification programs, or the pricing of healthy foods, or efforts to create demand for healthy, nutritious diets. Moreover, the transparency and standardization of methods has been poor, resulting in a lack of comparability. So as we start to generate new information, we are eager to provide guidance for high quality, transparent information. There has been a recent interest in integrating and standardizing economic analysis as part of impact evaluation. And several weeks ago, World Bank and 3IE had a great session on this topic. So what is the SEAMS Nutrition Project? SEAMS Nutrition stands for Strengthening Economic Evaluation for Multisectoral Strategies of Nutrition. This was developed in response to the issues that I described above. It builds on the ANH Academy technical brief that we launched a year ago. And it is currently a collaboration between the University of Washington, Helen Keller International, IFPRI, Results for Development, ILRI, and GAIN, with support from the Bill and Melinda Gates Foundation. And our objectives are to really develop and apply appropriate standardized methods for measuring cost and cost effectiveness, and to estimate cost and benefits for a series of approaches in several low-income countries. So let's have a quick overview of the common approach to guide how economic evaluations for nutrition are conducted. We think that the best and most useful data from economic evaluations will be data that's robust, data collected using transparent, comparable methods, and data that can directly inform decision-making. To that end, we have set about developing a common approach in 4 basic steps. Now, as I mentioned, this builds on, this is not new economic evaluation methods, rather it builds on best practices, and it builds on the resources that we shared in the previous session, particularly reference cases for conducting economic evaluation, costing, and benefit cost analysis. So let's look at each of these steps now. In the first stage of our proposed approach, evaluators align a program under study to a typology of interventions. Now, this typology builds from IFPRI and IFAD's nutrition sensitive value chain, and also considers this Sun compendium of actions for nutrition. And this will help us to promote apples to apple comparisons by having a typology. In the second stage, we design our economic evaluation around program impact pathways, theories of change, or results frameworks. And when these describe the hypothetical benefits or outcomes of a program, this allows us to articulate the activities, inputs, and costs along a program impact pathway. In the third stage, we then adapt generic tools to collect data alongside the impact evaluation. And as a fourth step, we would then compare the costs and benefits to reflect the relevant decision question. So let's have before we go on, I'll show you where we're applying this approach currently. We are developing and applying this common approach in 6 settings. They're all diverse multisectoral nutrition programs supported by our partners in Nepal, Burkina Faso, Kenya, Bangladesh, and Malawi. Now, I'm presenting just the framework today. If you're interested in the results from several of these projects, I encourage you next week to attend some of the sessions, and Chris will give you more information in that in the next presentation. So let's look at a detailed view of the common approach. As I mentioned, we are developing this typology on the nutrition sensitive value chain framework. Basically, first we build, look at interventions that increase the supply of high quality food. Then we think about a series of interventions or intervention components that help us to increase food availability. These would include investments in women empowerment and livelihood. Next, we think about that set of interventions that help to increase the demand for nutritious foods. We look at health and wash interventions that can reduce or minimize infections and acute malnutrition. And of course, we consider those intervention components that are essential for an enabling environment and that cross sectors, like good governance. So let's look at an actual example of this. We'll focus on just one of these sets as we go forward, which is agriculture. So here's an example of the program impact pathway. So at this point, we would map our interventions along the program impact pathway or your logic model for a given multisectoral nutrition program. In this case, you can see that we have health and nutrition, women's empowerment, agriculture, WASH, and intersectoral coordination. So our agriculture intervention in this case might be model farms and market linkages. We expect this to, we're going to understand the resources used, the inputs used in changing homestead production, and this also contributes to improving access and availability of nutritious foods, right? So what does that mean? If we look at just one component, for instance, the village model farms, we articulate that activity. There may be home visits that are agricultural extension visits. There may be distribution of inputs. What are the inputs involved in these activities, and what are the costs? And we're focused on direct intervention costs and costs to beneficiary. Now remember, we would need to do this for each intervention component, and as we showed you, in a complex setting, there are many of these. Now what we do is, once we calculate those costs, we can categorize them by a standard set of input and activity categories. I'm sharing with you right now these standardized activity categories that are disaggregated by the timing of the investment, either startup or recurrent. In the case of model farms, one might think about allocating the cost to home visits, which include agriculture extension, or perhaps distribution of inputs. Now we understand that, for instance, a home visit might also include behavior change communication. And so we'd make sure, as we allocate our costs, not to double count. The next stage in understanding in our framework is understanding the cost associated with meeting a range of outputs and outcomes. So depending on the sectors represented, we would choose these outcomes and outputs from a large list of potential benefits of multisectoral nutrition programs. For example, for the model farm, these are intended to increase the production of nutrient-rich foods and increase the intake of micronutrient-rich foods, and ultimately increase dietary diversity. Ultimately, they would also improve nutritional status, and they may also improve household income if there's surplus agricultural commodities that are marketed, right? So there's a range of benefits from multisectoral nutrition strategies. So what I'd like you to do now is think about your own research that you're involved in. What benefits are you likely to measure in your own research? I'd like to take a moment for you to think about this and enter your answer in the chat box. And remember, here I'm going to go back, and you can see we've tried to capture a full range of outputs, but I'm sure there's some that we missed. So what are some of the benefits that you have used in your own research? Chris, do we have any responses?
Just one: improved intake of iron and zinc. Now we've got a few more coming in.
Okay,
Knowledge
great.
and skills and women's empowerment, birth-related outcomes, and dietary diversity.
Great. So those are great examples of some of the benefits that we are trying to capture. All right. So finally, the final stage is tallying program costs and comparing with benefits. And what you're going to be hearing in the next presentation, of course, is information on applying this framework. In this year of our SEAMS Nutrition Project, we are actually working hard to improve the measurement of multisectoral benefits. We've made a lot of progress on cost efficiency and cost outcomes, but we're looking how do we compare and improve measures of cost effectiveness and measures of benefit cost in order to capture that full range of benefits. So hopefully next year, we'll be sharing with you more information on improved methods for aggregating the very many benefits associated with multisectoral interventions. So thank you for, many of you filled out our survey and you expressed your interest in integrating cost studies into impact evaluations. So I'm pleased to shift to our third session where Chris is going to go over the tools for cost data collection that we've been applying in the SEAMS Nutrition project. He'll be doing this to a synthetic multisectoral case study to better highlight the application. I want to really thank many of my partners and team members who've contributed to these presentations. And now, Chris, over to you.
Thank you, Carol. Give me a second here to get set up.
Yeah, and I'll stop sharing.
All right, can folks see my screen and hear me okay?
Yes.
Okay. All right, so thanks, Carol. Hi, everybody. Thank you so much for joining today. So you just heard a little bit about the different types of economic evaluation, why they're important, and Carol has just introduced our proposed common approach to the economic evaluation of multi-sector nutrition programs. And you might be thinking, you know, this is great, but how do I actually design and implement a costing study, which in our common approach is step 3 of this approach. Collecting and analyzing cost data from these large, complex programs is a unique process, but we hope that with this brief introduction, we'll make this process seem a little bit more achievable and approachable. So to support investigators to design and implement costing studies for multi-sector nutrition programs, we've delineated a series of standard costing steps and developed a set of tools to support studies along each step. These tools are available for any project to use and adapt as they wish. So the first step is to design a costing study. We've developed a matrix to guide investigators in defining the parameters and scope of your economic evaluation and your costing study. And we have a generic costing study protocol, which delineates common data collection methods and analytic approaches. The second step is to clearly describe your activities of your complex program. We have a program activity tracking sheet, which helps investigators to describe those complex activities, map them to a standardized set of activity codes, and identify sources of cost over the life course of the project. Most costing studies will include some form of qualitative microcosting to estimate total economic cost, including volunteer time and out-of-pocket expense, as well as to understand the allocation of time, for example, by staff across various activities. So we've developed a set of generic data collection and analysis tools for this purpose. We've been lucky enough in our projects that we have implementing partners who are generally large international NGOs who have been willing to share their expenditure data so that we can directly estimate and understand the financial cost of each program. If you don't have access to financial data, you can still estimate financial costs using qualitative microcosting. But if you do, we've generated a generic financial expenditure analysis template, which you can use if you have access similarly to raw expenditure data. And finally, or second to last, we have a spreadsheet model for extrapolating from your qualitative data to total economic cost estimates, and a spreadsheet that helps you combine your total financial and economic costs into an overall cost estimate. So we'll walk through each of these steps and introduce each tool as a way to familiarize you with our approach to costing studies. So to make this process a little bit more concrete, let's imagine that we're setting out as a team to cost a very large and complex multi-sector nutrition program in a West African country. This program combines nutrition-specific and nutrition-sensitive interventions from the health, education, social protection, WASH sectors, and agriculture and WASH, including the treatment of acute malnutrition, behavior change counseling, related to infant and young child feeding, conditional cash transfers, promotion of homestead food production using orange flesh, sweet potato, and biofortified crops, and the treatment of drinking water, as well as a set of interventions targeting the overall enabling environment, which we would call the governance sector, promoting collaboration and coordination across the sectors at the national and subnational levels. So the first step is to design your costing study. To support this, we have this economic evaluation matrix that you can use to define the scope and key parameters of your study. This matrix forces you to be very specific about your study objectives, whose costs you will include and exclude, how you will collect the costing data, who you will sample, and what time frame you're considering. You'll need to think about all of these issues carefully with your program partners, and the answers to each of them will always depend on your research question and what exactly you're trying to achieve. So for our particular West African multi-sector nutrition program, let's imagine that our primary objective is to estimate the total program cost. And by the way, it says economic evaluation matrix here, and it does guide you through the entire process of understanding your economic evaluation. Right now, our primary focus is on costing. So we'll stick to that. We also want to make sure that we estimate the cost per beneficiary, which, as Carol introduced, is a form of cost efficiency analysis. We'd like to compare these costs, the total cost and cost per beneficiary, across rural and urban parts of the country. And because we have the benefit of conducting this costing study in conjunction with a controlled impact evaluation, we can estimate the cost effectiveness of the program in terms of cost per stunting case averted and cost per DALY averted. We'll take two perspectives. The donor or payer perspective is one, meaning we want to include the costs borne by the funder of the program. And we'll also take the societal perspective, meaning that we want to include the opportunity cost and out-of-pocket expenses for project beneficiaries, government partners, and community volunteers. The societal perspective implies that all potential costs of the program are included. We'll take a mixed methods approach. So we'll have access to the program's financial expenditure data, and we'll also want to understand the activities and expenses of people not reported in the expenditure data, and so we'll do activity-based microcosting. We can't collect data across the entire country. We just simply don't have the resources, and so we'll randomly sample we'll randomly sample 4 districts and we'll make sure that we have an equal sample of rural versus urban areas. And we hope to cost the whole program over its 5-year lifespan. So once we've populated this matrix, and this is a challenging and lengthy process, you can use the generic costing protocol to describe your study methods in detail. We've included in this protocol some recommendations for the application of common costing methods, as well as some considerations around data management and human subjects protection. We think it's important to really clearly describe your program's core activities and to align them to a standardized typology of multi-sector nutrition interventions, as Carol mentioned. So for this large program, and most large programs will have an established program impact pathway or logical model, which you can leverage, which describes the program's activities and aligns them to some measurable outcomes and impact. Mapping the specific program impact pathway or logic model for your given program onto a standardized typology of nutrition interventions will help promote the comparability of your costing study, as it ensures that we know which interventions you're evaluating. So here we have a highly simplified program impact pathway for this hypothetical West African program. So once we've organized each activity under its relevant sector heading, we describe how each activity leads to a set of immediate outcomes, long-term outcomes, and then finally our proposed overall program impact. So once you've done that and you've articulated your program activities and mapped out your program impact pathway, you can use something like this project activity tracking sheet to detail all of the little sub-activities that are carried out as part of each of your program objectives. Here, we've organized the tracking sheet by sector, so you can see a small sample of activities that might be carried out as part of just the homestead food production activity under the banner of the ag sector. We describe each activity. We note when it happens. That's very important. We assign each a standardized code. For example, recruitment of staff might be coded as program installation. And again, this is really about promoting an apples to apples comparison of activity-based costs across complex projects and promoting the comparability of your study to other studies. For each activity, we think about who is incurring costs and what types of costs they're incurring. The F here stands for financial cost and the E stands for economic cost. So we might imagine that the activity of visiting and monitoring home gardens might incur financial cost to the NGO staff and economic cost to the frontline workers and project beneficiaries. For each activity, we figure out how we're going to collect data, where that data is going to come from. Most studies, as I said, will include some form of qualitative data collection to support microcosting and estimation of full economic cost. The goal of your qualitative data collection is to sample enough project staff, volunteers, beneficiaries, and other stakeholders to let you derive valid, representative, and reproducible estimates of the time they spend in project activities, traveling to those activities, their out-of-pocket costs, opportunity costs. If your study objective calls for the stratification of your estimates by some factor, for example, in this case, rural versus urban, you need to be able to sample accordingly to make sure that that variation is represented. You'll need to consider your sampling frame. What is the total population of people from which you will draw your sample? Will you take a convenience sample, which is much easier and less costly, but may lead to bias, or a random sample, which is unbiased, but more resource intensive? Will you use interviews, focus groups, active or passive observation, or some combination? The answer to these questions will always depend on your time and resources, and most importantly, on your research question. So we'll use interviews, focus group discussions, and observation to find out about the attendance of project activities, the frequency and duration of those activities, any out-of-pocket expenses, including travel costs and opportunity costs. And these might include missed wages at work. You might also imagine for project beneficiaries that in order to attend project activities, they might have to cover childcare, for example. And so we'd want to capture those expenses. We have a host of generic interview and focus group discussion guides that are available for you to adapt to your setting. Some of these target project beneficiaries, some of them target program staff, government staff, or frontline workers. Generally, they all ask the same set of core questions. Which of the project activities have you joined? How often do you participate in these activities? For how long? How do you get there? What do you pay in order to participate? And what do you miss out on because you participated in those activities? So just let's take a quick break here. And we're going to ask you to fill out your chat box again. So let's say that you are costing this large multi-sector program in a West African country. What are some of the potential costs to beneficiaries who are participating in the model farm or village homestead food production component of your study, which aims to promote the diversity of homestead agricultural production? So just take 30 seconds to respond in the chat box. And Carol, would you mind reading those out to me as they come in?
Sure. Time lost for labor or time spent away from harvest. Time and labor come in again. Crisis events like occurrence of a pandemic, like Ebola. A lot of people are saying labor, fertilizer, seed, training costs, transportation, labor, land.
Great. Great. Cool.
Yeah.
I think you've hit most of the ones that I wanted to talk about. Personal time and labor are, of course, very important. Hired labor, people participating in these programs might hire additional people to work on their land in order to support their activities. And of course, they have to pay for the cost of agricultural inputs. And you mentioned a couple others. They may have fees associated with trainings, they may pay for childcare, etc. These are all very important costs. And what we're finding in conducting these large-scale cost analyses in Nepal and other contexts is that they are huge drivers of the overall cost of the program. And if you ignore those costs, you're missing out on a large chunk of the total cost and investment made in these programs. It's also really valuable to use qualitative data to understand how staff spend their time across project activities. This helps you allocate their salary expenses to different activities. We found that a simple spreadsheet like this, and we have to credit the Upavan trial here for giving this, this idea and the template for the spreadsheet, can be a really useful and efficient way to work with staff to understand their allocation of FTE across program activities over the life course of the project. Typically, staff have a good idea of their FTE allocation. They have a really good idea of what they're supposed to be doing and what they end up doing, and they can tell you a lot about how those activities change over the life course of the project. And this is much easier and much more time efficient for you as a coster than to micro cost their activities and build up a picture of their activities over time, and can be validated, for example, by doing some micro costing. But we found that this approach, for at least for staff for whom you're just trying to understand the distribution of their time and allocating their financial costs, is a very nice and efficient method. So if you're lucky enough to have access to raw expenditure data, you can use the data to directly estimate the total financial cost of your program. But it can be really challenging to analyze expenditure data and to break it down. For some programs, your expenditure data will consist of tens of thousands of rows of expenses. So we've developed a relatively simple Excel-based expenditure analysis template, which allows you to insert raw expenditure data, convert it to a standard US dollar or other currency amount, code it by input type and category, and activity category. You can also code by platform, sector, trial arm, or really any other factor that you'd like to stratify your analysis on. The spreadsheet allows you to annualize large upfront costs, which need to be smoothed out over the life course of the project. So for example, you might imagine a line item for a vehicle purchase, let's say 500,000 in a local currency for a vehicle upfront at the start of the project. The spreadsheet automatically converts that total cost to a standard US dollar amount. It allows you, the analyst, to code that expense as an equipment or capital goods cost. In this case, let's say that we think this vehicle was only ever used for a distribution of agricultural inputs, and you can code it that way. If you think that this car was used for 5 or 6 different activities, and you know the distribution of those activities because of your qualitative data collection, the spreadsheet lets you do that as well and allocate across multiple activities. And you annualize this cost because it's a large upfront capital expense. And so the spreadsheet calculates an estimated annualized expense of $1,013 per year. Here on the left in the blue, you'll see the bare minimum of expenditure data, the date of the expense, the amount of the expense, and a brief description of the expense. And that's often what you'll have. But for many NGOs and other partners, especially those who report to USAID and other big donors, they will often have financial expenditure data that has assigned account and monitoring codes to each expense. And these can be enormously useful in contextualizing the expenses, especially if the text-based description is very short. And we encourage linking your financial data to those codes to support your analysis if you can. At the other end, the expenditure analysis template produces simple summaries of your data by input type, activity type, program year, platform, etc. And these outputs and summaries can be easily modified to suit your needs. It's all just in Excel. So once you have some qualitative data collected and you know the costs that are represented in your expenditure data, you can proceed to estimate your total economic cost. This is really a process of extrapolating from your sample, your qualitative sample, to the total project. These are costs, again, that are not captured in your financial expenditure data. So let's say for project beneficiaries, you take the average time that a beneficiary spends on program activities. And again, that's an average time that you derive from your qualitative data collection for a specific type of beneficiary. For example, we might be interested in beneficiaries in rural settings. The average time they spend on a specific project activity, we multiply it by the total typical wage rate for that type of person in your setting to arrive at an average total cost of that person's time. You then add that to their total average out-of-pocket expense and total average opportunity cost to arrive at a total average economic cost for a single project beneficiary for a single activity. You can multiply that total average economic cost by the estimated total number of beneficiaries to arrive at a total economic cost for beneficiaries overall. For example, you might know or estimate the number of beneficiaries in a rural context. You multiply by the average total economic cost for the activity per beneficiary in that setting to arrive at a total economic cost. You repeat this process for each type of project volunteer, government partner, and type of beneficiary, anyone incurring costs that's not reflected in your financial data. And as you do this, what you're effectively doing is extrapolating up from your qualitative sample to arrive at a total cost for the overall project. So finally, once you have your estimates of your financial and economic costs, it's time to combine the two. Here, we've stratified financial and economic costs by input type, but of course you do this for activity type and sector and platform as needed. Here we show how the two types can be summed. And you can see for this hypothetical project in this West African country, the total economic cost is approximately $4 million out of an estimated 20 million total, so it's substantial. And those costs are restricted to person time, so volunteer time or labor cost, and travel expenses. So this would be, for example, the costs associated with people traveling to and from a project training out of pocket. The whole point of costing, of course, is generally to ask the question of what you're getting for your money. For this project, we've estimated a total cost of $20 million. We think that the project reached 100,000 pregnant women, 500,000 beneficiaries and almost 100,000 households. We can divide the total cost by the numbers reached in order to estimate cost per different types of project beneficiary. And we can compare these estimates to other similar projects to understand if our project is efficiently reaching participants. I don't have time to go into detail on how cost effectiveness analysis works and the other ways to compare costs and benefits of a program, for example, benefit cost analysis. But let's imagine here that we've paired this cost analysis with a careful controlled impact evaluation. That evaluation estimated that our project averted 33,000 cases of stunting and almost 40,000 disability adjusted life years. We can use our cost estimates to describe the cost per stunting and cost per DALY averted. And of course, we said we wanted to stratify by rural versus urban in order to understand if there was a differential effect of the context on our cost efficiency and cost effectiveness. So we generate total estimated cost in the rural setting of our country and the urban setting of our country. Plus, we know the numbers reached and the numbers of stunting cases and DALYs averted in each setting because our Impact evaluation was also similarly structured to develop representative stratified estimates. And this allows us to compare the cost efficiency and cost of effectiveness of the program in rural versus urban parts of our country. So thank you so much for listening. I hope this brief overview has piqued your interest in learning about costing, integrating costing into your ongoing studies, and that you might consider using our freely available and adaptable tools. If you'd like to see empirical examples of our work, check out 2 talks coming up at ANH on June 30th. Carol is leading a session with 2 of our team members. They're presenting economic evaluations of 2 different multi-sector nutrition projects, both supported by IFPRI. And then we have a 1-minute rapid poster session related to our progress on the costing of Nepal's Suahara 2 program. Thank you very much.
Okay, this is Chloe. I guess I'll start now. Can everyone see my presentation? Good? Okay.
Yep.
Great. So thanks for sticking around. My name is Chloe Puett. In section 4 here, I'll be discussing benefits and challenges of economic evaluation for multisectoral nutrition interventions, lessons from the field. Just a little bit of background and introduction. Why exactly should the multisectoral nutrition community care about economic analysis and specifically cost effectiveness analysis? Well, the answer may be more obvious now. Back in 2012, Action Against Hunger was one of the first NGOs that really started systematically looking at cost effectiveness analysis for nutrition. And there were 2 reasons for this. The first was a research interest. They wanted to contribute to building the evidence base on cost effectiveness of some of their strategic nutrition programs. And there was also a donor interest. Their major donors had begun asking them about the value for money of their investments, and they weren't sure how to answer those questions. My experience in the nutrition community is that there's often a sense of nervousness around economic analysis and cost effectiveness analysis, because sometimes our nutrition-specific or multisectoral nutrition programs don't really look cost-effective compared to other options. And this can be a particular challenge for multisectoral and nutrition-sensitive programs, as we'll see throughout this presentation. So I'll be discussing some of the benefits and challenges around economic analysis in this sector, using findings from multiple studies, both including nutrition-sensitive and nutrition-specific interventions. So a quick outline. We'll start with some general reflections on building the evidence base. Then we'll move to application for nutrition-sensitive programs, looking at a case study on community gardens in Zimbabwe, and then an overview of findings on several cash transfers for nutrition outcomes. Then we'll shift gears a bit and look at some principles to understand generally for economic analysis, including the importance of understanding household costs, and the influence of context on the findings of an economic analysis. So, building the evidence base on cost and cost effectiveness of multisectoral nutrition interventions. What does this involve? Well, we track costs in similar programs across different contexts, and in this way we can see in general what resources we use, what are the trends. So this enables us to forecast and budget more appropriately. And all of this enables us to assess affordability and to better understand costs, so we can do things like advocate to ministries of finance when looking to have local governments help support programs and co-fund along with international donors. Taking the time to look more closely at costs gives us opportunities to learn from stakeholders who have good insights into program costs, such as implementing staff, who have a very good idea of, in their specific programs, where resources might be used more efficiently, as well as program beneficiaries who spend time and money in the program and have opportunity costs for that time. All of this can lead us to understand the economic consequences of how we implement, and to think what changes could be made to improve efficiency, including for households participating in our programs? An example of the benefits that can come from assessing program costs comes from an analysis of a cash transfer to prevent undernutrition in Burkina Faso. The intervention area in this setting was large and sparsely populated, and we also had some security concerns. And some of the precautions taken with distribution of cash in this setting caused delays in our distribution. We found several cost drivers in our analysis, including high transport costs. And this was both because the private partner that we worked with to distribute the cash brought in armed cars to distribute to more remote villages. And because due to the intervention area being so spread out, we had our program staff visiting their villages every month to discreetly remind them about the upcoming distribution. Because of the distribution delays, we also had very long wait times in remote villages, a day and longer. We conducted a sensitivity analysis, and because we had measured household costs, we could assign a monetary value to the time spent by beneficiaries in waiting for distributions. And we found that larger efficiency gains actually came from reducing beneficiary wait times compared to a potential reduction in transport costs. So this provides a good example of the insights we can gain when looking closely at costs, and especially at household costs, and shows that the information can feed into program design. There are some challenges in building the evidence base. The first is a methodological challenge that's really a limitation of cost effectiveness analysis in general, which is that you divide your total costs by just one outcome at a time. And so that means that this outcome should really be strategically chosen, or be one that you feel really best reflects the performance of your program. But here we have a challenge for multisectoral nutrition and nutrition-sensitive programs, because there's a longer impact pathway in these programs between our activities and the nutrition outcomes. And there's often a smaller effect on these outcomes compared to nutrition-specific programs, for example. And so therefore, these programs appear less cost-effective per nutrition outcome. And that's all to say that these programs actually produce multiple benefits. They just can't really be included in an economic analysis in a systematic way, and we'll discuss this more later. So this scenario can often lead stakeholders to refuse to publish unfavorable results of cost effectiveness analysis, and I've seen this more than once. And I'm here to suggest today that we need to be braver about building the evidence base, because what may seem expensive now with limited evidence may actually be standard in the future. And not all of our interventions are going to be as cost effective as vitamin A capsule distribution, for example, but we may find that they have many more benefits. Another challenge is that decisions on what is considered cost effective are not necessarily static, and decision rules can change. For example, the methods were recently changed that are used to calculate disability adjusted life years, or DALYs, a measure used in cost utility analyses for nutrition. And these dropped age weighting and discounting. And this effectively increases estimates of DALYs averted. And we did an analysis with colleagues and found that compared to historical estimates, the new methods increased DALYs averted specifically for acute malnutrition and CMAM programs to 2 to 3 times higher. So this makes more programs look cost effective with current decision rules, because we're dividing the same costs by a greater number of DALYs. So just to say that our metrics and benchmarks can change over time, even as black and white as they may seem at one moment. Now we'll apply some of these general benefits and challenges to a program in Zimbabwe providing community vegetable gardens for people living with HIV. This is an example of a program that was not considered cost-effective according to decision rules. So we'll start with the bad news first. In summary, providing gardens to people living with HIV cost around $13,000 in 2020 US dollars per household with food consumption score raised to an acceptable level, and cost around $19,000 per household with household dietary diversity score raised to the upper tertile. These were our outcome measures in this setting. So the conclusion of the analysis was that due to the high cost relative to Zimbabwe's per capita GDP, this program wasn't likely to be affordable in government services despite all the benefits that it provided. So maybe at first glance, this sounds like a bad investment, but let's look at more of the details. The gardens seem to provide a valuable asset in communities, and in community discussions, households cited many intangible benefits which couldn't be monetized for economic analysis. This included reduced isolation and anxiety, increased strength, community cohesion and reduced stigma against people living with HIV, and they also cited tangible benefits in money earned in selling vegetables. So gardens were a source of income for households, and we included an estimate of the increased income as a negative cost in our analysis. And this was almost balanced out by the total value of participants' time spent tending the garden. And there was some suggestion of sustainability of benefits, since more than 80% of the gardens were still functioning more than 1 year after the program ended. And the table on the right there is just a summary of some of the costs that beneficiaries paid with proceeds from vegetable sales. We had some challenges in assessing the economic value of this program. Usually in an economic analysis, you would want to put your results into context by making some kind of comparison and, of course, stating the limitations of that comparison. But here there was nothing. We found evidence on cost effectiveness of treatment and prevention of HIV. We found evidence on the effectiveness of food assistance programs on our outcome measures in other settings. But how do you compare community agriculture and asset provision with medical treatment? A major limitation was the lack of comprehensive and appropriate outcome indicator for livelihoods programs for people living with HIV. An ideal measure might include clinical markers and food security indicators, but we still would not be able to include some of these important intangible benefits that this program produced. We have just a quick poll question here, so you can indicate your answer yes or no in the chat box. Can intangible benefits be converted into a monetary value for economic analysis? Intangible benefits. Put your answer in the chat box. And maybe, Carol, as the results come in, you can let me know what the audience is saying.
Let's see. We've got 2 responses that say, well, we've got 3 responses so far. Go ahead and place your vote. Can intangible benefits be converted to monetary value? They're coming in. The majority are saying yes.
Okay. So in this context, I just wanted to make sure that these concepts were making sense to everyone. This is sort of some economic vocabulary. We have intangible and tangible benefits. And tangible benefits that you can, the word tangible seems like you can touch them and understand them and really use them. Tangible benefits can be converted to a monetary value. So this includes things like time use and other actual expense data like income. Income can obviously be converted to a monetary value because it is one. But intangible benefits such as decreased stress, improved strength. These are things that, as Carol mentioned in the first presentation, are difficult to put a dollar value on. There's really no market for these sorts of benefits, so we don't have a dollar value that's easy to quote. So intangible benefits actually are those that cannot be converted to a monetary value for economic analysis. But I'm glad I asked because I want to be sure we're all on the same page. Just quickly on some final caveats for the Zimbabwe analysis. First, it's possible that this program specifically was implemented inefficiently and that this negatively impacted the analysis. For example, there were some delays in the start of the program at specific activities within the program due to political unrest. There's some evidence from recent studies that integrated ag projects can have lower costs, including from the Mama Sasha project in Western Kenya. Also, perhaps benefit cost analysis would have been a better approach to valuing this program. However, we still would not have valued all of the intangible benefits, so it would have had many of the same limitations that a cost effectiveness analysis did. Hopefully, as we continue to build the evidence base in this sector, we can better judge whether there are possibilities for improved economic value in other settings. Another example of an intervention with many benefits, and we're looking at specific nutrition outcomes, is cash transfers in many humanitarian settings. Just as with Zimbabwe, performing economic analysis with a focus on nutrition to the exclusion of other benefits presents some limitations. Here we have 4 humanitarian distribution interventions implemented during the hunger gap, and these were assessed using cluster randomized controlled trials. We have Pakistan and Niger as part of the Rafani trial, and in Burkina Faso with the MAM Out trial, and these are all cash distributions. And I've included another study here in Chad that is a nutrition-specific food distribution, but that also looks to prevent undernutrition using a staple ration and a preventive dose of ready-to-use supplementary food. So all of these trials had economic analyses conducted with the objective to see whether they were effective and cost-effective at preventing undernutrition, specifically wasting and possibly stunting. But of these 4 studies, in only 1 study in Pakistan did we see any preventive effect on wasting and stunting. The other studies showed some effect on dietary diversity, food access, and some health outcomes for the nutrition-specific intervention. So in the 1 study where we prevented undernutrition, that's Rafani, Pakistan, for the economic analysis, we found that it cost almost $5,000 per case of wasting prevented. And between the 3 arms of the study, it was around $1,000 on average per case of stunting prevented. And for the cost per disability adjusted life year, we found between around $800 and $1,200 when using age weighting and discounting, and between around $400 and $600 without age weighting and discounting. So here you see an application of this methods change we were talking about before for calculating DALYs, and how much lower the DALY estimates are with these changes of dropping age weighting and discounting. These are all, the DALY estimates are all considered very cost effective according to international thresholds based on GDP per capita benchmarks. But we did have to be careful in interpreting these results. Because of course, we're not spending all of this money just on preventing undernutrition. The goal of cash transfers is much broader, with livelihoods protection, for example, among other benefits. And for this money we spent, we're preventing wasting and stunting, along with many, many other additional benefits in this setting. So this is a good example of where investments in a non-health sector may be more effective in meeting a country's nutrition goals. So importantly, who pays for that? In our interpretation, we indicated that rather than looking to necessarily allocate funds from the health budget in Pakistan to support cash transfers, instead, the government could see this evidence of cost effectiveness according to international thresholds as added justification for sustaining investment in their existing social safety net program, upon which the Rafani trial was based. And that this really underscores this program as being part of a multisectoral effort to address undernutrition among poor households. So I'm going to switch gears a bit now from these broader considerations about multisectoral nutrition and now discuss a specific methodological aspect of economic analysis, which has a lot of policy relevance. As we continue to build the evidence base, we should keep in mind the key role that household costs play in understanding the economic implications of multisectoral nutrition interventions. So when we talk about measuring household costs, this means asking program beneficiaries about their time and cost in participating in a program. We've discussed this throughout our presentations today. And this can help us understand financial barriers to program access and utilization that households face. In particular, we can get interesting information comparing the burden of time and cost that different implementation modalities require of households. So, for example, we have data from 3 settings on household costs involved in having community health workers, or CHWs, provide treatment for acute malnutrition rather than getting care from CMAM facilities. In Pakistan, facility care cost 2 times the money of community health worker care. In Mali, facility care cost 3 times the money and twice the time of community health worker care. And in Bangladesh, hospital-based care costs 6 times that of community health worker care to households. So this provides interesting information that highlights what kinds of program modalities may be most useful for communities. We can also use household costs to see how, for example, implementation costs can be shifted to beneficiaries. Here's an example from the cash and voucher transfer program in Pakistan that we just discussed. The implementing organization made a decision to distribute cash centrally at a district capital to reduce their operational costs. And so only 15% of cash beneficiaries received their transfer in their own village, compared to voucher beneficiaries who could redeem their benefit close to home. Traveling to the district capital to collect cash took up to 1 day of travel due to bus schedules. So as you can see in the table, for the 3 study arms, single cash, double cash, and food vouchers, we have the average monthly household cost, the monthly transfer value, and the cost to the household as a percent of the transfer value. And you can see in the bottom row that the arm receiving the least cash had a very high percent of their transfer taken up by transport cost at 20%, relative to the voucher arm at 5%. And this has implications for program design. We can either aim to distribute cash locally or at least provide a transport top-up to prevent this kind of erosion of benefits in the future. I hope I've demonstrated that household costs are useful to understand, but it does take time and resources to get good quality data. The default tends to be to want to use surveys, but questions on time and cost and income require very good enumerator training as well as time to explain them well to beneficiaries. And survey data is biased if questions are unclear and answers are not well formulated. From my experience with qualitative approaches, it is easier to ensure that these questions are understood. Of course, qualitative approaches can take more time compared to surveys, and it can be difficult to get representative data for larger populations. And finally, there may be some contexts in which household costs may not be relevant to collect, but they should be considered in planning, and I think researchers should need to opt out rather than opt in, given how useful the information can be for a cost analysis. Just as the importance of household costs can vary by program context, there are many other aspects of cost and cost-effectiveness analysis that can be influenced by context-dependent factors. Cost estimates and calculation methods can vary across studies for many reasons. I think we all know that different countries have different salary structures, which make personnel costs vary widely across geographic areas. There are also program characteristics, the way programs are implemented, and methodological reasons why costs of similar programs can vary between studies. So we need to be careful comparing across contexts, as these comparisons can be misleading. Obviously, we need to be careful in comparing across different contexts in terms of geography, disease burden, etc. But I want to focus on some more subtle contextual factors and areas where context matters, even in comparisons within the same country. Coverage can affect program effectiveness and hence cost effectiveness, as we saw in a program in Mali. Here we had community health workers treating acute malnutrition compared to facility-based CMAM. There were problems enrolling children in the CMAM arm, and this arm had just 1/3 of the beneficiaries of the community health worker arm. And this was due to a couple of reasons, possibly lack of community sensitization in the CMAM arm, which was an ongoing program, as well as potential researcher bias favoring this arm as the new and interesting intervention modality using community health workers. So we corrected for this and did a scenario analysis, assuming the same number of children in both arms. And when we did this, our conclusions changed, and the CMAM program became the more cost-effective arm as seen in the bottom row of the table. As you can see, the cost per child recovered, this was our main outcome in this study, in the community health worker arm was around $250, while the CMAM arm base case was $500, so double the cost. But assuming the same coverage in the last column, CMAM cost closer to $200 per child recovered and was the most cost-effective option. So in this setting, cost-effectiveness depended on coverage. Here in Pakistan, we had a similar program with community health workers treating acute malnutrition. This time, there were some political challenges that influenced the context. The two programs, community health workers and CMAM, had similar costs. But in this case, CMAM looked more effective for several reasons. The community health workers had poor quality of care in this setting, which led to lower effectiveness. These workers were overburdened. There was a polio campaign at the same time as the study, And they didn't get a salary top-up, as they usually did, in adding this new task of treating acute malnutrition to their workload, and this led to low motivation. There were also unclear ways of working between the NGO conducting the study and the government, since there was a change in government midway through the study. Finally, community health worker supervisors, who were government staff, did not participate in the first half of the project. So you can imagine if your supervisor isn't supervising you on a particular task, you're not going to focus on that task and perform it with particularly good quality. In the end, there was uncertainty as to which program was more cost-effective, as you can see in the bottom row. CMAM was on average slightly more cost-effective in this setting. So a few key takeaway points from this presentation. First, economic analysis can provide important insights into resource use, and this information can help improve program design. We need to build the evidence base to better understand economic aspects of our multisectoral nutrition programs. Second, household costs are particularly important to understand and should be considered in study planning. However, it should be known that collecting these data requires resources and dedicated effort. Third, we should be cautious when taking costs and cost effectiveness results out of context, and really keep the nuances in mind that affect these outcomes, especially as we grow the evidence base and have just a few data points to start out. Finally, we have much more work to do in improving economic analysis to appropriately value interventions with multiple non-health benefits. And this includes trying to better understand the value of what is currently considered to be intangible. So we're going to launch a poll here with a few questions just as we started this lab. And I will read you question 1. I'll read all 3 questions to you. First, question number 1. What is a specific challenge in applying cost-effectiveness methods to multisectoral nutrition programs? Is it that A, cost-effectiveness methods divide total cost by one outcome, while MSNPs produce multiple outcomes? Is it B, that MSNPs have a longer impact pathway between intervention activities and nutrition outcomes? C, MSNP may appear less cost-effective for nutrition outcomes compared to nutrition-specific interventions? Or D, all of the above? I'll just read all the questions out while you guys are answering. Question number 2, what is a challenge in collecting data on household costs? Is it that A, it can be difficult to make questions on concepts of time, cost, and income well understood for beneficiaries? Is it B, that it requires detailed training for survey enumerators? C, that qualitative data can be expensive and time-consuming to collect at scale? Or D, all of the above? And the last question is, what is an example of an intangible benefit? I'll give a few examples. Is it A, reduced discrimination? B, time spent working in a community garden, for example? C, reduced stress? D, income earned from selling vegetables? Or is it E, A, B, and C, the first 3 options? Or is it F, A, and C, the first and third option? Okay, so we're getting some answers coming in. Still wait for all of your answers. Have about 40% of everyone feeding back. Okay. About half of you are answering.
Chloe, would you mind advancing the slides for the other questions?
Sure. All right. Here's question 2. Challenge in collecting data on household costs. And here's the third slide. This may help you better answer that one. An example of an intangible benefit. Okay, we have about 60% of everyone. If I can get a few more, we can start going over these. Okay, seems like we've hit a plateau. So we'll start going over the answers. And so in the first one, what is a specific challenge? It looks like most people answered all of the above, and these are all challenges in assessing cost effectiveness to multisectoral nutrition, that you just get to choose one outcome while these programs produce multiple outcomes, that there's a longer impact pathway, and that makes these programs appear less cost effective because the effect is smaller. And so all of these are true, all of the above. And for the second, what is a challenge in collecting data on household costs? Is that, yes, all three of them are correct. It can be difficult to make questions on concepts of time, cost, and income well understood. It requires detailed training, and qualitative data can be expensive and time consuming to collect at scale. So everyone got that right, or 84% got that one right. And this one is sort of like a trick question, because we had asked about intangible benefits before. So what is an intangible benefit? We have reduced discrimination, that's A. B, time spent working in a community garden. C, reduced stress. And D, income earned from selling vegetables. So is it one of those specifically, or is it A, B, and C, or A and C? And the answer is A and C. First it was A, B, and C, but B is actually time spent working, which is a tangible benefit. So A and C, reduced discrimination and reduced stress, are two intangible benefits. Great. Good job, everyone. So thank you for attending the presentation. Here's the references that were referred to throughout the presentation. And now, Ask an Expert, we're going to move on to your questions.
Thank you, Chris and Chloe, for great presentations. I enjoyed them a lot. I hope others did as well. Let me get my camera back on. So we answered a few of your questions in the chat box, but we're going to take your questions now. So if you have any additional questions, now is the time to do it. Hallie, can you confirm this session goes for another 20 minutes? Is that correct? Great. So we have time to answer some of your questions that have come in on the chat box, and also to answer new ones. Now, I'm going to start off by answering some questions. And Chloe, I might put you on the spot, so if this, if you're not prepared, just let me know. So Cecilia Gonzalez asks us about doing economic evaluation for a longer time. She was interested in the sustainability of programs and how to evaluate them. And this question, her original question, actually came in during your presentation. So if you'd like to give a response to that, that's great. If not, I'm happy to. Her specific original question was, in terms of sustainability of home gardens, I would think that we would want the gardens to be viable for longer than a year in order to maintain their benefit and impact. Are there programs that follow them for longer? How many years would it make sense to follow them? And in terms of economic evaluation, do the cost-benefit calculations get adjusted when you follow a program for longer? So if you want to take a shot at that, great. Otherwise, I can help to answer it as well.
Yeah, I'm happy to say my thoughts. And then Carol, I'm happy to hear your thoughts too. I think that is a really excellent question. And that was one of the limitations that we mentioned in our analysis, is that, you know, sustainability over time is really important for this sort of program. In this analysis, we didn't model into the future. We could have, you know, as sort of, you would want to include potential program costs as well as benefits over time. And depending on what kinds of benefits you include, for example, if you'd done a benefit cost analysis and monetized benefits somehow in that setting by looking at, you know, just the income, for example, you could actually look over time, and then you would need to take the net present value by discounting future benefits and costs. And that's, you know, a way that you would compare them over time, but you would need to discount when looking over many, many years. We couldn't really discount the, you know, food consumption score and the household dietary diversity score. There's not really good methods to do that yet, but I would say that's certainly for future studies to address. And yeah, sustainability after 1 year doesn't mean too much, but it's an indication. You know, many programs you could see after 1 year that people would have forgotten about it. But in this setting, we really did. We visited about half of the gardens and they were still going strong. So it's just an indication, really. Carol, do you have any thoughts to add?
Yeah, thanks, Chloe. So Cecilia, actually, it's very difficult to get funding to follow up on demonstration projects. We have tried in the past, and the donor typically doesn't support going back and seeing what's happened. Now, one exception to that is a study conducted by Alo Jelly and colleagues at IFPRI, where they were looking at an integrated agriculture and early childhood development program, and they in fact were able to go back a year later and evaluate the impacts, and those results will be published. So in answer to your question, can you come back? Generally, we don't have the resources to do it. Now, what happens if you don't have the resources to go back? That's when we start to model the results, and we can create models that help us vary the parameters, saying, well, let's assume that in the future the benefits are the same, or let's cut them in half, or let's expand them. So we can use scenario analysis and model potential impacts of low sustainability, high sustainability, or no sustainability. So thanks for that question. The second question we're going to answer is one by Jose Maguina. Sorry if I'm not pronouncing your names correctly. And he asks, and I'm going to interpret this question broadly, how one calculates the costs and benefits when including health programs into a cost-benefit analysis. Of course, the answer to this could take another day, but if you're really just interested in health programs alone, then in fact, one would measure the cost of the intervention from the provider or the service delivery. One would also be interested in measuring the cost averted because of this health intervention. So to give you an example, if you were interested in treating or preventing severe acute malnutrition, then you can look at the cost averted by preventing severe acute malnutrition, right? So if you've prevented it, cost savings could be you didn't have to go to a hospital for a week, right? So that's an averted cost. So you want to include the intervention costs, you want to include the averted medical costs, and you want to include the cost to the beneficiary, to the mother. Now, how do you include those benefits? It really depends. That's a hard question. For most health programs, they have a direct health benefit that can be translated into an illness averted, and in many cases, a death averted. Now, in cost-benefit analysis, Chloe alluded to this, this requires that we have to value the disability or the death, put a dollar value to it. There are several methods to valuing a life year saved. Not everybody agrees with those methods. I would like to refer you to the Harvard guidelines on benefit cost analysis. We've made these available in the resources to read more about it. So thanks for your answer. All right, maybe I could ask Chris to answer Cecilia's question on, are there principles or tools for calculating opportunity costs of beneficiaries? Hopefully you did go through some of those, but maybe you can talk about some of the principles and how we value time and reiterate the tools available. Thank you.
Sure. And I think, Cecilia, I appreciate your question because I think opportunity cost is the trickiest component of beneficiary cost to measure. You know, you can ask people about how much time they spend in an activity, and that's pretty straightforward, although as Chloe pointed out, there are methodological challenges. You can ask people about their out-of-pocket expense to participate, but the counterfactual, that's like what they would have been involved in had they not been part of this project, is more or less theoretical, right? And so the best that we can often do is to ask, you know, do you think you missed out on something because you participated in this project that would otherwise have been financially impactful for you? And then we try to value that. The best approach, however, would be to leverage an impact evaluation where you had a controlled study and you were able to say or look at financial effects across the treatment arms, because otherwise, you know, asking people about what might have happened is always going to be necessarily hypothetical.
Great, thank you. Chloe, we have a number of questions maybe that you can address from Cecilia Gonzalez and Michael Feel free, I'm going to read them to you. The first question is, the question of coverage versus economic effectiveness is interesting because it's my understanding that community health workers are there to achieve better coverage. So in the study, CMAM would be cheaper and more effective, question mark. And then the second question is, CMAM versus the use of community health workers indicates CMAM to be cost effective. However, what's the threshold for considering cost versus benefits achieved by using community health workers?
Okay, those are good questions. For the question on coverage versus effectiveness, just to clarify, in this setting, the CMAM arm was sort of at a tertiary facility located, sort of above the community level. So community health workers were actually in the villages visiting people's households. And that was something that's not, it's sort of like a extension of reach beyond the traditional CMAM setup. So in this setting, community health workers are going to achieve better coverage than a facility. You have people going out into villages and actually going to doorsteps, which can really work well in some communities. In Bangladesh, for example, this was sort of a more conservative area where women couldn't move around a lot, and the community health workers just really achieved that full reach. And so that's why we would think that community health workers would do better. But in that particular setting in Mali, there were some sort of biases that looked like they were sort of favoring the CHW program. So we wanted to put like a penalty on that and just see, okay, if we achieved full coverage in both, in a completely equal world, which would be more cost effective. But the conclusion of the analysis was that community health workers were more cost effective because that's what it appeared to be in the base case. For the second question on comparing community health workers and CMAM and what's the threshold, just to step back a minute, in some studies looking at this, you could use a DALY, and the threshold would be what Carol mentioned in her slide, looking at cost per DALY compared to per capita GDP in the particular country. And in the Pakistan and Mali studies, we didn't do that. We didn't calculate DALYs. We got a cost per recovery, which was our outcome measure. Recovery is achieving a health improvement, so that's an outcome measure. And there's actually a growing field of literature where we have cost per recovery in different settings. And so we were able to contextualize those results using these different settings. Even though it's not exactly in the same country, you can kind of start to get a general understanding. So if you're lucky enough, unlike Zimbabwe, for example, where we didn't have any comparison, any other program to compare it with at all for context, if you're doing cost effectiveness in CMAM or community health workers versus CMAM, you will have a bigger context of findings in which to place the findings of your particular study. I don't know if that answers your questions. Let me know if there's any follow-up.
Thank you, Chloe. I'm going to answer 2 quick questions and then 2 longer questions. Cecilia asks, even if benefits are intangible, how do we value them in the evaluation? And Cecilia, the answer is a quick one. They're intangible. You can't put a monetary value on them. But you know what you can do, and what one ought to do, is one must use qualitative narratives to highlight these intangible benefits. All right, and so the truth is, it's very difficult to capture these in economic evaluations. They aren't good for capturing them. Remember, the strongest economic evaluation recognizes that burden of disease or burden of malnutrition or burden of women's of governance issues or women's issues are important to call out, to talk about feasibility and acceptability of your interventions, political will. There's so many factors that affect the introduction and scale up of the interventions we're interested in, and that economic evaluation is an important one, but not the only one. The other easy question I'm going to answer is by Alexander Ikachiku, and he asks, can economic evaluation parameters be employed to look at toxic substances in food and the associated health effects and therefore economic impacts? Absolutely. Food safety issues are critical and important and probably understudied. And so yes, methods for capturing the cost associated with toxic substances that result in illness and maybe even death, this can be captured by economic evaluation. The cost of not addressing them or the cost of addressing them can also be captured. So the easy question is yes. So two longer questions that will require a little bit longer answer. One is, some comparisons are difficult, for example, to compare, to include in the same economic evaluation. For example, nutrition sensitive interventions, the kinds we've been talking about, compared to dietary supplementation programs like micronutrient supplementation. So how do we calculate the benefits, and for how many years are benefits calculated? That's a great question. For many years, we have only been generating information on efforts to address micronutrient malnutrition through direct supplementation. Recently, we've been moving the needle by looking at biofortification. We have as we mentioned already, we have very few good, robust studies of looking at food-based strategies, home gardens, other agriculture programs to address, for instance, micronutrient interventions. So to date, people have often said, wow, dietary vitamin A capsule supplementation is so cost effective. And so how do you make those comparisons? You have to apply the same framework. So you have to recognize that a vitamin A capsule supplementation does a singular thing. It addresses vitamin A deficiency. If we are able to capture a fuller range of benefits from nutrition sensitive interventions, then those benefits are going to look better compared to simply addressing vitamin A deficiency, right? So one has to set up your program in the same fashion. You would have to look at nutrition sensitive interventions impact on vitamin A deficiency, but you could also look at increased value of production and consumption of nutrient-rich foods. And so let's say it's more expensive to have an agriculture project, not if you deduct the value of consumption, and not if you add back in perhaps the added income that the household earned. So it's really a matter of setting up that decision program and articulating all of the costs and all of the impacts for each, and then combining them. And the truth is, if a vitamin A capsule supplementation gives you the same effect for vitamin A deficiency at a lower cost as a decision maker, you may consider to invest in that. It's not, it's a challenging problem. Then the next question is by Cecilia Gonzalez. She says, if we're interested in smaller programs that are not necessarily research projects, but want to use economic evaluation tools or build capacity with local practitioners to use these tools, is what we are sharing today accessible? Yes, we will make these available to you. Please get in touch with us if you're interested in applying these tools. Are there other tools you'd recommend? Absolutely. We have shared with you a wonderful document written by Chloe that gives guidance on conducting cost effectiveness for local NGOs. And it is one of the references in the materials that we've shared with you. I highly recommend it. Another guidance document is the USAID measure has developed a wonderful guidance on conducting economic evaluations for public health. So we have shared with you a number of other tools. We've also shared a third one on guidance on understanding the cost of early childhood development. So please see the materials we shared with you in advance of this learning lab for more tools.
Carol, can I just add to that?
Please, yes, both of you, Chloe and Chris.
Just want to add that many of these simple costing methods, for example, observing the time that people spend in activities, asking them about that time, there's an entire set of methods called time motion study that we didn't really talk about, but these very simple tools to understand how people spend their time are incredibly relevant for program planners and implementers, totally outside of a research context. But in terms of improving the efficiency of your programs, many of these methods are immediately transportable.
Chloe, would you like to answer anything?
I guess one thing that I would just say from the sort of practitioner side for Cecilia and looking at outside of a research context. The only challenge, based on my experience planning many of these studies with an NGO, is that you may not be able to get sort of robust evidence on the impact or outcome without kind of a study set up and having like a counterfactual to compare what results you found in your setting. But like Chris was saying, there's plenty that you can do with costs and even cost efficiency, cost per beneficiary. Building the evidence base does not have to go all the way to cost effectiveness, because we are in an information void, really, and we need to start understanding what these programs cost. And to get time use and get information on, different intervention modalities and how beneficiaries interact with those modalities, what they value more, what takes more of their time, what's more useful for them, is completely policy relevant and very, very useful information without having any kind of randomized control trial up and going.
Great, thank you. We have time for just a couple more questions. Let's see, Mariko asks, are there examples that one intervention is more cost efficient against the other, but the result is vice versa when looking at cost effectiveness? That is a great question, and an empirical one. I'm thinking of, it's hard for me to answer that. I guess, Chloe, I don't know if you have examples of that, because you've actually looked at cost efficiency and cost effectiveness. So the question is, might something be cheaper but not be as cost effective? And for sure, in the field of cost effectiveness analysis, there are cases where there may be a cheaper intervention, but it isn't as effective. And so it might be more cost efficient than another one. But if it isn't as cost effective, if the results, it's a decision maker's prerogative to decide whether or not to go with a cheaper intervention that may not be as effective as another. So Chloe, you may have it.
I'm racking my brain trying to think of specific examples, and they're not coming up. But I think, one general idea to keep in mind is that, we're not looking for cheap is not necessarily better, because sometimes you have to spend resources to get those effects, to get the quality of implementation that is going to enable effect. So with my, from what I've seen in the field and doing many of these different studies, I have basically just, I don't think that we should be talking about cheap interventions at this point.
Great. Right.
I think,
Go ahead, Chris.
Just a hypothetical example of the one I think we're mostly, that all of us would be familiar with, if a national level behavior change communication is poorly designed and doesn't meet the meet its objectives of changing behavior, then it might reach hundreds of millions of people at a small cost, a relatively small cost. But if you don't change the health behavior outcomes of your interest, then the intervention is not cost effective. Or if you change them only a little bit, it might be less cost effective than it is cost efficient.
And we have 1 minute to go. My battery might die, but let me actually clarify a question from Mosumi Das, which is, how can impact evaluation studies incorporate a cost-benefit analysis? A bit confused. So, Mosumi, we basically what we're saying is, if somebody is planning an impact evaluation, they will have to find some additional resources to incorporate cost data collection alongside that impact evaluation. And then once your impact estimates are completed, you would follow much of what we've described today, estimating your costs and comparing those to the cost benefit. So from a planning perspective, you would have to get additional funding and a team together to be able to work alongside your impact evaluation team. I hope that clarifies that. Well, Hallie, I think, and others, I want to thank Chris and Chloe and each and every one of you for joining this Learning Lab. We're sorry we didn't get to work with you in person. I want to thank ANH for organizing this opportunity, and maybe just ask my co-presenters if they wanted to say anything. But from me, I'm really grateful that you all joined us and you stayed with us for 2 hours. Thanks.
Thank you all.
Thank you.